Our Chief Health Editor, Dr. Partha Nandi, joining us right now live. Dr. Nandi, let's start with the news about changes that are being made to the availability of one of the vaccines.
Yeah, good news, Carolyn. The change involves the amount of the Moderna COVID-19 vaccine that's being delivered and distributed. And what the FDA is saying now is that they've given the green light to the company to include up to 15 doses in a vial instead of the current 10 doses that Moderna has been putting in each vial. So that means the company can speed up shipments of the vaccine and get more shots in arms faster. The 15 dose vials, we're expecting that they begin shipping that in the coming weeks. So good news.
Certainly good news there. Dr. Nandi, you reported earlier this week that Pfizer's vaccine provided strong protection to teenagers in the clinical trial. So are there any other vaccines that are showing such promise in protecting our kids?
Yeah, to me, it's always about getting more people involved in the vaccines, right? So today we heard that Johnson & Johnson has begun testing its one-dose coronavirus vaccine in kids 12 to 17. For now, Carolyn, the trial is enrolling teenagers in Spain and in the UK, but we're expected to get US and other countries in very soon. The study is an expansion of Johnson & Johnson's current trial that's looking at different dose levels and vaccination schedules for adults. The company also plans on adding pregnant women and younger kids to the study eventually. Again, more news because we get more people involved in the vaccination to get that herd immunity.
Absolutely, especially so many pregnant women worried about whether to do it or not. Another thing is sad to say, another variant of the coronavirus has been reported here in Michigan. So what can you tell us about this case?
Yeah, this one came from Brazil, Carolyn, and now it's confirmed in a case of a female resident of Bay County, Michigan. It's not known how she contracted the variant, but she was diagnosed in early March and has since recovered. Health officials are investigating. They're getting the exposure history, trying to identify the source of the infection, and they're conducting what's called contact tracing to find out where it comes from. And there's extreme concern about getting others infected, including people who've already had the COVID-19 one. So remember, again, the messages, and I'm like a broken record, it's not time to let your guard down. We got a few months left, as I think Dr. Fauci talked about. Let's not drop the ball on the 2-yard line, right? Wear a mask, social distance, avoid crowds, wash your hands often, and get vaccinated if you can. There should be no reason for people to be hesitant. And we'll get out of this. I'm confident we'll get out of this, but we've got to stay on the plan and not think it's all over. So, but I think a lot of good news coming out in my perspective. A lot of good news. We're expanding the vaccine. We're getting more folks in. I think that the Michigan and other states are doing a great job in getting people shots in arms. So I'm excited about it.
Certainly not a broken record, Dr. Nandi. Thank you so much for your expertise. As always, have a happy Easter with you and your family.
Happy Easter to you. Thank you.
Thank you. Alan.